All right, let's now shift our attention to South Korea. That became a bit of a global success after it managed to curb the pandemic early on. But a recent surge in the COVID-19 infections is, of course, threatening the country's health infrastructure. South Korea has reported a record 1,097 new cases of infections. And this, of course, was the fifth consecutive day of daily infections that surpassed the 1,000 mark. While South Korea's aggressive tracing and testing has worked during the beginning of the pandemic, the recent surge has tested the country's healthcare system. Now, the latest wave stems mostly from widespread clusters rather than large isolated outbreaks like what was witnessed in the previous outbreak. It has confounded the country's efforts to contain the infections, and South Korea is now running short of hospital beds. Meanwhile, in an outbreak in a prison in Seoul, about 188 people, prison inmates, were found to have been infected. And this takes the total number of infections linked to the facility to about 215. But there are also smaller outbreaks in other nursing homes, hospitals, churches, a ski resort and a golf course. The medical experts and politicians have criticized the government for being too loose with social distancing rules. Now, the government has been reluctant to tighten social distancing restrictions, worrying that business will grind to a halt and this will hurt the economy. South Korea's drug watchdog is likely to approve the emergency use of AstraZeneca's COVID-19 vaccine early next year. And according to Prime Minister Chung Si-kyun, vaccinations could start either in the month of February or perhaps as early as March. The government was also in talks with Pfizer, Moderna and Johnson & Johnson for procuring COVID-19 vaccines.